I'm Evan the counselor, and one of the questions I most commonly get is how do I stop drinking? And this is a hard question to answer because addiction is so complicated. People abuse substances for a variety of different reasons, and it goes on the continuum of severity. So I never really knew how to answer this question, but I think there's a couple general steps that you can take right off the bat regardless of where you're at on the spectrum or where you're at with your drinking. And this goes for substance use as well. But when it comes to drinking, the first thing I want people to consider is that you can't necessarily just stop. Now, a lot of people could just stop and they would be okay, but the problem is alcohol has deadly withdrawals. It's one of the few substances that could actually kill you to get off of. And it's an interesting story here in Minnesota when we went into COVID lockdown and deciding what businesses were essential. Obviously, the first thing that didn't come to mind were liquor stores, but a lot of people in the addiction community who are actually treating addictions advocated for liquor stores to be considered essential businesses because people could actually die if they weren't able to get alcohol. So usually this is going to happen to people who probably drink every day or significant amounts, but everyone's body is different and the level of withdrawal they're going to go through is going to vary. So the first thing you need to consider, especially if you're drinking really heavily and you're quitting, is you need to get some form of medical detox. Now that could come in the form of going to the hospital, going to an inpatient treatment center that has doctors that are able to do detox. And not everyone could necessarily access that, or nor is it really affordable. And we'll talk about that in this as well as some what if you don't have access to insurance or other health care. But also, you can just go to a general practitioner and they would be able to put you on a taper. So they'll use different meds like Librium or other benzos, which coincidentally are the other types of meds like a Xanax that could give you deadly withdrawal. So they work on the same system. That's why they would give you smaller doses and taper you down so that withdrawal wouldn't be uncomfortable. So, first thing on the hierarchy of needs is survival. And we got to be sure that when you're coming off alcohol that you're in a safe place. So that's step number one, is taking care of the withdrawal, whether it be going to treatment, going to the hospital, detox, or going to see your doctor and not taking matters into your own hands and just getting off of it, which would be dangerous. So then the second step of two is getting an assessment, right? And that's why I was saying it was difficult for me to say, well, you go to treatment or you could do this. But we don't know because there's some people, a lot of the clients I get are not necessarily like far gone alcoholics or anything like that. They're people who have fallen into a pattern where they're using alcohol to cope and they're drinking too much. It's starting to cause issues in their life. They're at the beginning stages of where it's problematic. And my recommendation for them is going to be much different than somebody who's coming in on their third treatment and went on another relapse run and having some severe consequences, withdrawal cycle. So I've done hundreds and hundreds of these assessments, and I have a variety of different things that I recommend depending on where it's at. And I think a lot of people fall under the misconception like, oh yeah, everyone should just go to treatment or go to AA or whatever. And sometimes for people who are more severe, you start at those higher levels and work your way down. But as counselors, often we recommend the least restrictive option when possible. So let's say someone's between inpatient and outpatient. So inpatient, like where you would be actually staying there for a month or two. We would say, hey, let's try outpatient first. Unless the client's like, hey, no, I really think I need inpatient. Then yeah, absolutely. Because I think the higher up you go, just naturally, as you step down, that's usually the best course of action. But a lot of people can be successful at the lower levels of care. So number two is that you definitely want to get an assessment from an addiction professional. And that's the key part, an addiction professional. And every state, every region is going to have a different certification for that. Like here in Minnesota, myself, I'm a licensed alcohol and drug counselor. It's a licensure. In other places, it's a therapist who has a certificate. Sometimes they're at a bachelor's level, master's level, but you want someone with those credentials who are going to know the different options, know how to specifically assess for substance use disorders, and be able to give you an array of recommendations. And hopefully people will give you a couple recommendations, even if they say, hey, I really think you'd benefit most from inpatient or residential. Sometimes they call it. Here are some different recommendations, and you could go do your homework from there. So at the end of the day, those are the two steps: take care of withdrawal and get an assessment. And that works for really any other substance as well. Just with alcohol, the withdrawal is a much more of a consideration. And then the last part of this is just, well, what if I can't afford it? Usually the recommendations I give for folks who really can't afford, they don't have insurance, or they just can't afford these kind of services, inpatient. I mean, without insurance, it's like practically unaffordable. I mean, we're talking tens of thousands of dollars, $30,000 a month. Even for the nicest places, it's really expensive. So usually for those folks, I'd recommend, hey, yeah, if you're struggling with alcoholism, go do a medical taper, um, take care of the withdrawals. It shouldn't be as expensive to go to a general practitioner, but at some point you just have to do it. And some people will like look online and they'll slowly lower the drinks. It's just really hard to manage on your own, especially if you're an alcoholic or struggle with the alcohol use disorder. It's really hard because you're having to manage your own drinking, and that's, you have to look online, and there's just no great way of doing that. And the reason you're in this issue is because you're having trouble controlling it, so it's difficult as it is. So that's why if you could get even from a general practitioner and get some like lower cost meds and getting that out of the way, and then going to like a community support program, something like Smart Recovery AA, that's free. And so you could go get support from people who have been through it as well. That could be extremely powerful. And then make sure you have the medications taken care of and get that community support, and see if that doesn't help. A lot of people do get sober that way. So if you're at a place where you're even thinking about it, go get an assessment, go get help. It's totally worth it.